So I'm so happy to be back with K.A.S.S.I.E Live, and our guest tonight. Actually, you know that song, It's a Small World After All? It's like I have to sing that every time I get a guest on the couch because we find some sort of connection. It's just something like we didn't know each other from a box of rocks when we met, and now we're like, oh yeah, well I did this and we know her and blah, 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 blah. So without further ado to you all, we hope that you are enjoying your new year. But without further ado, let me introduce our guest, Ms. Danisha Burnett, with a lot of alphabet soup behind her name. So thank you for joining us.
Thank you for having me.
And now you can tell us your official name and title in alphabet soup.
So as you said, my name is Danisha Burnett, and I am a licensed professional clinical counselor.
Okay.
That means I'm independently licensed in the state of Ohio. I also am a consultant, and I'm a professor at Xavier University. I also have my own company called The Crown, which focuses on mental health, education, and empowerment and consulting, as well as I have a women's organization called the Queen Size Mission, and our focus is on empowering women and young ladies to fulfill their royal identity and all of their God-given purpose.
Well, thank God that you found time to come sit on the couch with us.
I wouldn't have missed it for the world.
We've been trying to get you on here since, was it November?
October, November, I
October,
think.
okay.
We were scheduled for November.
Yeah, because we met at the conference. We met at a
Correct.
women's conference, and I love to attend those. I love the empowerment. I love women coming together to make themselves better and stronger. And as you know, the K.A.S.S.I.E Project is keeping all survivors safe, informed, and emancipated. Now, we are a non-clinical initiative. However, we, of course, work with and are able to refer you to clinicians when you are ready. And you didn't initially say therapist. You said you are a licensed
Professional clinical counselor, which is a big term to say therapist.
Okay, but you know what? That term therapist is what I was saying. That turns some people off. So if you say, hey, you know, I have this therapist, why don't you, nope, nope. But if you say counselor, you know, or something like that, it's a little more user-friendly. Have you found that to be a truth with people that you work with?
I think it has a lot to do with people's frames of references. So based on maybe their schooling or their education, most people are familiar with a guidance counselor.
Okay.
So that might feel a little bit more open, or sometimes people have gone to a massage therapist or a physical therapist. So usually it's about people's experiences, but I don't usually find that people are adverse to, they either love both terms or they hate both terms.
Okay. So in comparison to a life coach, is that the same, or is that just another name for it? Do you guys do different things?
It's not the same.
Okay.
As a therapist, we might do similar things that a life coach would do, but a therapist has more levels of training and degrees than a life coach has. There may be some overlap, but there are certain things that a life coach can't do. For example, I can diagnose and treat. A life coach is probably going to help you prioritize your life, maybe set some goals, set some steps to take the goal. But in terms of actually offering treatment and care, a life coach can't do that.
When you say treatment, you can write prescriptions?
No. I can write a treatment plan based on what your needs are. So, for example, cognitive behavioral therapy or dialectical behavioral therapy are forms of treatment. So if a person has major depressive disorder, if a person is going through marital issues, so there are certain interventions that you will use. A doctor or someone who is licensed as maybe a nurse practitioner or something like that can write prescriptions.
Okay.
Therapists cannot unless we have that training and that licensure.
Okay. So what really excited me when I heard you speak was the way that you were speaking about survivors of sexual and domestic abuse and the trauma. You know, we do use the term PTSD, but just saying trauma as a whole, I mean, we have been traumatized.
Absolutely.
And it affects us, you know, our entire being, I think. And then, of course, if we get to the point where we are able to speak to a counselor, a licensed counselor, or a therapist, then we are stuck in a place. And so she was speaking on trauma and how it affected us, and I felt like she was like all in my head, all in my business. And I'm like, whoa, I really, really would love for her to speak to our viewers, our followers, just so that they can get a clue, because a lot of things you said, I was like, really, wow, is that why I do this? And is this? So I guess we're going to have like an unofficial therapy session, not necessarily for me, but for the masses, but just the questions about the things that you were speaking on. at the conference. Okay, so where do we start? Okay, you just got back from doing a trauma workshop or retreat. What was that you did?
So for one of my other jobs, I'm a consultant for a trauma-informed, trauma-responsive program out of New York.
Okay.
And so we contract with different agencies, schools, any places that provide usually human services, residential programs, hospitals, and we look at the impact of trauma and how trauma impacts us at an individual level, but also at an organizational level.
Okay.
So I was teaching and training in Pittsburgh on Thursday and Friday, and then I flew in and I was teaching in Kentucky on the impact of trauma and how essentially trauma changes our worldview. So the best thing that we can do is be informed about how trauma changes us so we can be proactive and manage or mitigate those changes. So you use the words PTSD. PTSD is an actual diagnosis. However, you don't necessarily have to qualify or have the criteria for that diagnosis to have been impacted by trauma. Trauma impacts us all. How it impacts us is the continuum of whether or not you end up in a category that might fall under the PTSD diagnosis. PTSD is an actual diagnosis. However, you don't necessarily have to qualify or have the criteria for that diagnosis to have been impacted by trauma. Trauma impacts us all. How it impacts us is the continuum of whether or not you end up in a category that might fall under the PTSD diagnosis.
Okay. Let me ask you a question about
Okay.
that, because I have, I guess I recently started using the term relating to us, to survivors.
Okay.
And I had heard other people mention it, and I, read it in some of my research and my works and things like that. But you said that it's actually, it needs to be diagnosed.
Correct.
Okay. So if I am affected by multiple triggers, if I am depressed and anything of that sort, I mean, if I'm having issues sleeping or things like that, from something that happened when mine started when I was 5. So when something that happened as far back as over many, many decades,
Just a few decades.
can I say that, or do I have to go to, can I say, I have PTSD, or do I have to go to a doctor for that?
I personally, as a member of the field, don't want people to say they have PTSD.
Okay.
So that would be the same as if you go to the doctor. You might have a cold, you might have pneumonia, you might have the flu, and based on certain symptoms, they will diagnose what you have. Is it cancer? Is it a stomach ulcer? So there are specific criteria that is used in the clinical profession to identify what a person might have. The reason diagnosis is important is because if we don't know what we're treating, then we don't know how to treat it. Trauma, and I'll talk about this in a little bit more, there is an impact of trauma that is not necessarily meeting the criteria of PTSD.
Okay.
So PTSD stands for post-traumatic stress disorder. You can absolutely be impacted by trauma and still not meet the criteria for PTSD. So just a little bit of information with the new diagnostic manual that they're looking for to come out next. They want to have a diagnosis that still captures that, but that does not rise to the level of PTSD. So some of the names are around like complex trauma stress or things like that, where it's not a person who's having nightmares and flashbacks, a person who is not having or reliving those visceral emotions, a person who does not necessarily have anxiety, panic attacks, life alterations to avoid those cues, a person who does not necessarily have that emotion dysregulation, but they absolutely had a traumatic experience happen in their lives.
Okay.
So everyone who has trauma does not have PTSD.
Okay.
Everyone who has PTSD has experienced a trauma.
Okay.
So there's a definition of trauma. And Bessel van der Kolk, who's the leading doctor around this subject, describes trauma as when you have had a event that your internal and external resources were not enough to manage. So an example of that is you and I might be in the same car accident. If I've already lost 4 people that year, if I already maybe have depression, if I already don't have car insurance and that was my only ride to get where we needed to go, maybe you have stable mental health, you have resources, you have a job that's going to pay you to be off of work. That same car accident might impact us differently based on my internal and external resources. So what can be traumatic for one person may not be as traumatic for the next person, which is again why we have to be very careful with saying things like this person has PTSD.
Gotcha.
Again, all trauma does not lead to PTSD, and it's really important to make sure that we don't even fragilize survivors and say they have PTSD. They may be struggling,
Okay.
but they may not have any kinds of nightmares or flashbacks, or they're able to still function and go to work and do the things that they need to do. Not that they weren't impacted,
Okay.
just not to that same or nth degree.
So that means I owe y'all an apology, because I was using that term all willy-nilly, like, you know, all of us had it. And of course, I know that different people are affected differently by the types of trauma that they have experienced. And that leads to another question.